really enjoyed helping people navigate that around healthcare, and it's such a big area, and it can be complex, and it's something that like has a lot of out-of-pocket exposure for people. So protecting them and getting them through these illnesses and sicknesses to where they get to the other side, and it's just been very appealing to me to like really help people, and so that's what I've really done.
Good morning. Today our guest is Warren Kolb. Warren, thank you and welcome for coming on the show.
Great. Well, thank you for having me. I appreciate it, Fred.
Hey, it's amazing. I didn't know you. I met you on a telephone call back in March, knowing that we were one day going to do this, and so I've been looking forward to this for a long time.
Yeah, great. Likewise.
Well, you've got a lot of experience in insurance, 38 years, my understanding, and you own a company called Individual Insurance Solutions.
That's correct.
Correct.
Yes.
So what got you into insurance? Why is that the field you chose?
Yeah, well, I don't know if I really chose it or it chose me. And so, but, it was interesting. I was out of high school and going to college, and I was working at a bank, and it was kind of interesting. One thing just kind of led to another, working in the finance type of industry. And there was a lady that worked there that came to me and made the recommendation that I should talk to her husband, that he was in the insurance business. And so I did that and met with him. Even though I didn't go to work for him, I went to work for someone else and just kind of learned the business. And I've always been in the health insurance side of business. And so not property and casualty, car insurance, homeowners, none of that, but always having everything to do from the health insurance, Medicare, small business type of health insurance side. And but I just got into it, really enjoyed helping people navigate that around healthcare, and it's such a big area, and it can be complex, and it's something that like has a lot of out-of-pocket exposure for people. So protecting them and getting them through these illnesses and sicknesses to where they get to the other side, and it's just been very appealing to me to like really help people. And so that's what I've really done.
That's great. I've been a paramedic for 35 years, so helping people is all I've ever wanted to do.
Yeah.
And then, we just found this need. So many people call and ask questions. They need to know about what's the best thing to do. Should I get Advantage? Should I get traditional Medicare? So that's one of the reasons I wanted to get you here, because you have been selling Medicare or educating people on Medicare since 1988.
That's correct. Yes.
Yeah, and there are a few people who have that much experience in this Medicare world.
Sure.
So when I call people and I was trying to get the right person to come on, people kept mentioning your name.
Oh, okay.
Corey
Great.
Hagen Risk Partners said, Fred, you need to talk to Warren Kolb.
That's great.
He's the guy you need to talk to. So obviously I've been excited because my business is taking care of seniors. And so whether it's the seniors or whether it's their children who are adults, these questions come up all the time. So we're going to have you help us with some of these. But you also do a lot with long-term care insurance as well.
That's correct.
So we're going to get you back for another episode, and we're going to talk all about that.
Great.
So again, I'm excited to have you here. A lot of questions. So the first question that I want to know is, what's the difference between Medicare and Medicaid?
Okay. So Medicaid, first off, is when someone falls below a federal poverty level or the federal poverty level income. That income level is about $16,000 for a single person.
Okay.
And so a person would go on Medicaid, traditionally under age 65. Now, when someone is above age 65, they can also go on Medicaid as well. But when you turn 65, you're eligible for Medicare. And now, if you're eligible for Medicaid as well, you're known as what they call as a dual qualifier. You qualify for both Medicaid and Medicare. And that's simply where Medicaid will pay your out-of-pocket expenses on Medicare, is what happens. But let's just call it the term more of a indigent type of situation, low income for Medicaid. Medicare is everybody that's age 65 and above. Now, you can qualify for Medicare if you're younger than 65, but you have to be what they call as Social Security disabled.
Okay.
And then that's where you would get Medicare Part A and Part B, and then you can fill those coverage gaps.
Wow, that's great information. So Medicaid is more for the indigent,
Yes.
somebody under 65. Does everyone who turns 65 years old qualify to be in Medicare if they've never worked?
Well, a great question. And the answer to that is when you turn 65, you are eligible for Medicare Part A and Part B. Now, Part A comes at no charge for most people because most people at the age 65 have worked 10 or more years or 40 or more quarters. So in that case, they wouldn't pay anything for Medicare Part A. Now, Medicare Part B, they do have to pay for when they make that election to get Medicare. Now, so yes, everybody pretty much is eligible for it when you turn age 65. Now, so let's just say two scenarios. Someone just moved to the United States. There are some requirements that they have to be here for a certain period of time to be eligible. They have to have a certain type of green card, type of things. There's some requirements there. The other piece of this is that you may have a situation where there's someone in the household that they have worked 40 years, a long time, 50 years they've worked in the United States. And so they get Medicare Part A at no charge. They may have a spouse that, got out of school, started having children, never worked. And in that situation, as long as one of the household members of the married party, as long as one of them has 40 or more quarters, 10 or more years of working in the United States, that secondary person will also get Medicare Part A at no charge.
That's great information. So I'm so glad we have you here because sometimes I don't even know the right questions to ask, and that was amazing. When should someone really start planning to get on to Medicare?
So, as we just talked about Medicare, turning 65 is kind of a key. Now, we do a lot of Medicare education meetings at companies and things, and I like to tell HR directors to start inviting people at age 62. And because I think it's good for people to hear it more than once. We also have people call our office and they say, "Hey, Warren, I'm 67 years of age and I'm retiring at the end of the month, and today's the 20th or 22nd." And it's like, oh boy, we got a lot to do here. So in a perfect world, I would say that at least give us a call 3 to 4 months in advance of somebody turning age 65. That's at least. In a perfect world, a year earlier, just to kind of set things in motion because there's some things that they may want to plan for. And then for sure 6 months, and then we tighten that up again at 3 or 4 months, and then we make all the applications for coverage and as well as Medicare itself.
Great.
So.
Now, this may be a myth, but is there a penalty for applying or getting on to Medicare after the age of 65?
So, great question. And let me just go ahead and preface this and say this way. People who are turning age 65, they are inundated with unwanted phone calls and they are inundated with unwanted mail, okay? And they have no idea who these people are. There's another component is that all of a sudden their sister, their brother, their cousin, their friends, they're experts in Medicare. And the one thing that we continuously hear from people is that if I don't enroll in Medicare now, I'm going to get all these penalties. Okay, so to clear this up, and so what I will tell everybody is this. You have really two different scenarios when somebody turns age 65, and that is either somebody's working at age 65 or somebody's not working at age 65.
Okay.
It's A or B. So in a situation that somebody is not working at age 65 and they do not have like employer-based health insurance, okay, that person needs to enroll in Medicare, okay? They get Medicare Part A at no charge. That person does not have any other creditable coverage. They're not working. Now, they could have coverage through their spouse that is working, and if they're going to stay on that employer-based coverage, no problem. They don't have to do anything.
Okay.
But for the person that's not working, does not have employer-based coverage, does not have an option through a spouse, they definitely want to enroll in Medicare Part A. They definitely want to get Medicare Part B because that is where they can get penalties is if they do not have like an employer-based creditable type of health insurance plan. So now, for a person that turns age 65, and let's say that they work at a really great company, that company provides really great benefits, maybe they don't pay anything to have that insurance plan. And so they're just thrilled to have it. They don't want to make any changes. I would just say this. They do not have to enroll in Medicare, and they're not going to get any penalties because they are just simply, they already have creditable coverage. It's fine. And so when you turn 65, you get what they call as an initial election period. And that's for that person that is not working somewhere else and they need to make their election. There's another election period called a special election period, an SEP, and that is when somebody works past age 65 and they've had creditable coverage and now they're going to lose it, then we can trigger what we call as a special election period to make things active, and there will not be any penalties there.
So that can be at age 68. If you're working, you're getting
70.
great insurance, you can do it at any time. Now, at the age of 65, for this person who's working, who is insured, do they have to notify Medicare that they're not going to take the election?
So, good question. The answer is this. So, and it's kind of funny with these. These are great questions, okay? And I'll just say there's a bunch of little prongs that go off of these. And so what I'll just say is this. For the person that is working past age 65, they don't need to do anything at all. They do not. They don't have to let Medicare know anything. They just keep on trucking, okay? Now, what makes things a little bit easier, I'll say, is for a person that is maybe like taking Medicare early, okay? Excuse me, not taking Medicare early, taking Social Security income early.
Okay.
So let's say that, and we'll talk today about people being single, but people also being married.
Okay, great.
So for a person in either situation, but somebody may take Social Security income early at age 62.
Right.
If you're already taking Social Security income prior to age 65, when you turn 65, you will automatically receive a red, white, and blue Medicare card, okay? And it will have both Medicare Part A and Medicare Part B on there. Now, if somebody is, let's say, a stay-at-home person, their spouse is working, and they've taken Social Security income early, and they've decided to say, I'm covered on the group insurance plan with my spouse, I don't really need this. They can give up Medicare Part B that has a charge, but they cannot give up Medicare Part A. They have to keep it, okay? It's just the rules. When you're getting Social Security income, you're going to receive Medicare Part A, no ifs, ands, or buts, and you can't give it up.
And so you don't have to ask for it. It's coming to you.
It's coming to you. Okay, that's right.
Man, these are great.
So that's the only way that you automatically get Medicare. Now, also, let's just say that somebody works past age 65.
Okay.
They do not take they're not taking Social Security income, but they can only work until, say, age 70 before Social Security sends them the letter that says, hey, you can no longer delay taking Social Security income. At that point in time, once they start taking Social Security income at that time, they'll now receive that new red, white, and blue card, but it will only have Medicare Part A on it.
Okay.
So the difference is when that person is 62 taking Social Security income early, they get the card that says A and B, and if they don't want B, they have to send it back. When they're age 70, they're only going to get a card that says Part A because they're presuming they're still working and covered on an employer-based plan. They don't need Part B at this point.
So are you penalized at this point for working? Not really?
So,
by Social Security?
No, sir.
Okay.
Well, let me say this. So Social Security and Medicare are two different
Sure.
things. So if we stay with Medicare, if somebody does not enroll in Medicare and they stay on their employer-based group health insurance plan, there's no penalties at all.
Great.
The only thing that we want to do, and we'll interject this terminology here, and I'll just kind of talk with my hands and say we just want to make sure that there's no gaps there and that it's just very clean. So when they come off their employer-based plan and they go on to Medicare, Medicare Part B, Medicare Part D, Medicare Part C, we just want to make sure there's no gaps. And as long as we make sure there's no gaps, there's not going to be no penalties there.
That's great. Now, I'm going to ask you this question kind of just out of left field here. when you're turning 62 years old, you probably need to be talking to you. People need to be talking to you or their insurance provider. Is that a fair statement?
So I would say that I use the example, if we go do Medicare education meetings, I think it's good for people to start attending those when they're age 62. And just the reason why, because the more you hear it, the more you learn about it. And it's a lot of information, because when you're younger and you work at a company, an employer says, hey, Warren or Fred, here's your benefits this year. And here's your 4 different options. And this one is $25 a pay period. This one's $50. This one's $75. And you just make an easy election. Well, when it comes to the Medicare, it's all on you. So you have to learn it and understand it yourself. And so that's what, we just mentioned. It's good for people to hear it, ahead of time. Now, I do think it's good for them to speak with somebody that's a knowledge expert in that field. So, having somebody, like myself, I think is ideal versus just a general insurance person that has a bunch of different specialties.
Right. Great. Well, we're going to definitely make sure that at the end of the podcast, people know how to reach out to you and get you out to their employee, those group meetings once a year that they have. Now, you've been talking about Medicare Part A and Medicare Part B. I know that there's Medicare Part A through Part E is what we discussed earlier. Let's talk about each one of these and why. The A is the one that everyone's going to get. So let's talk about, we talked about B, and there's a cost to that.
Sure.
And we talked a little bit about that. But let's hear about this alphabet of Medicare.
Sure, absolutely. So there is Medicare Part A, which is the hospital portion of Medicare, okay? Inpatient type services, Medicare Part A. And what we know is Medicare Part A is, again, as long as someone has worked in the United States 10 or more years, 40 more quarters, or married to somebody that fits that parameter as well, there's no charge for Medicare Part A. So that's your inpatient type services. Medicare Part B is your outpatient type services. On your red, white, and blue Medicare card, it'll say health insurance, and so medical insurance. And that is for outpatient type services. That's doctor visits, x-rays, MRI, CT scan, those type of things that you would have done. And also, it would also be for like chemotherapy on an outpatient basis, cancer treatment. So that's Medicare Part B. So A and B is your medical benefits that you get from Medicare, okay? And I will also say this very upfront, is that as you mentioned, I've been putting people in Medicare plans for a very long time. And I will tell you that Medicare works very well. Medicare is not something that some people should be scared of, and we have people, when we start talking about these different plans, they say, you know what, oh gosh, I hate to go on a government-run health plan. But I will tell you, Medicare really does an excellent job. And of all of the thousands of people that we have enrolled in these plans, we just do not receive phone calls at our office of stating that Medicare doesn't cover this, Medicare doesn't cover. We just don't get those phone calls. And so Medicare actually works very well, and people are very happy on these type plans. Now, getting back to your question.
Well, hold on. I just want to interject right now while we're here. As a clinician for 34 years, as an administrator in EMS, as somebody who's worked with many hospitals, 70% of what comes through a hospital is typically Medicare. Through an EMS agency. It's Medicare. So it does pay well. It is a great program. So I just wanted to make sure that, from a clinical standpoint, I do see that it works. And there's some misconceptions of what it covers and what everyone asks, does it cover long-term care? Does it cover a caregivers in your home? And so there's some things that it just doesn't cover.
Right.
Well, now we'll go on into C and the rest of the alphabet.
So we got Medicare A and B. Now, when you hear Medicare Part C, that is known as Medicare Advantage.
Okay.
So what happens here is that literally let me say this, we provide Medicare education about Medicare itself, okay? We'll talk more on that. And let me back up just a second if I can. So let's go back to Medicare Part B, and there's something I want everybody to know about Medicare Part B, is that there is a charge for Medicare Part B, okay? B as in boy. Medicare Part B, and for 2026, everybody pays $202.90 for Medicare Part B. It does not matter who you are, how wealthy you are, how poor you are. Everybody pays $202.90 for Medicare Part B.
Per month?
Per month.
Okay.
That is correct. Everybody does. Now, if you fall in, and let me just say that Medicare Part B, there's this piece to it, and it's called IRMAA, Income Related Monthly Adjustment Amount. So let's just compare it to a tax and say that the more money you make, the more you pay for your Medicare Part B.
Okay.
So there's thresholds. So on an individual person, it's like $109,000 in income. So anybody that files a single tax return that's less than 109, they're going to pay the 20290. Anybody on a couple that's filing jointly, and this is based on modified adjusted gross income, okay? So it's everything. So if you're a couple filing jointly, it's 218, okay? So if you're below that, 20290 is what you pay. When you fall into those categories that go above that in the higher brackets to higher income, then there is an adjustment for it. So what I want everybody to know on this call here today is this. This IRMAA adjustment, they look at your income from 2 years previously. So somebody that's going to be paying a Part B premium in 2026, they're going to look at your tax return in 2024. Wow, okay. So now all of a sudden the wheels are spinning and thinking, well, Warren, myself and my spouse were working in 2024. Here it is 2026 and we've retired. We no longer have that job-based income, and now we're living on Social Security income, dividends, interest, royalties, whatever they may be, and our income came way down. We don't have that anymore. So you can file a form called an SSA 44 form that basically says, I have work stoppage. I'm no longer working. You need to minus out, deduct that job-based income for myself, my spouse, and now it shows I have a lower income. Right. And so that's a very important thing. I find a lot of times that people don't know about Medicare Part B premiums, and that's something that can be very important for them to know.
That's great information. I'd never heard this at all. Can you just mention that form number again?
Sure. It's the form underneath Social Security, and it's SSA 44.
That's great. Thank you, Warren. That's great.
Sure. Okay, great. Okay. So that's A and B. That's for today for that high level, and then so we move over to Part C. So now I'll just say this: when someone becomes Medicare eligible and they're no longer working and they need to choose a Medicare plan, they're going to choose either a Medicare supplement plan or they're going to choose a Medicare Advantage plan. Okay. Now, Medicare Part C is Medicare Advantage, okay? And what makes that Medicare Advantage is that a person is going to assign their A and B benefits over here that they have, A and B. They're going to elect those coverages, and then if they choose Medicare Advantage, they will assign those benefits to the particular insurance company that they want to have their benefits with. Now, naturally, we help clients look at these different types of plans out here, because there's all the different insurance companies, hospitals that provide these different plans, and they have different levels of benefits. Some plans are PPO, some plans are HMO, some plans have more benefits around dental, more benefits around vision, things like that, lower copays. Some are higher copays, but have larger networks of doctors or hospitals. So you have a lot of variations. There's not one size that fits all, and so but you assign your benefits, A and B benefits, over to that insurance company, and that's what they call this is Medicare Part C as in cat. And so that is the Medicare Advantage plans that's there. Now, so to go through the alphabet, so we got A and B that we're done. We talked about C. Now it'd be Medicare Part D. Medicare Part D, D for drugs, D for prescription drugs.
Okay.
So that Part D prescription drug card is a very important part. And I will just say this for the people on listening to the show is this: even if you are not taking any medications, you want to get a prescription drug card, because that's where you can get into penalties if you do not do that. Okay, so very important to make sure you elect a prescription drug card. But that Medicare Part D that gets you the drug card, so that when you go down to a pharmacy to go purchase medicines, you have coverage.
You have coverage. There's still a copay, or is?
Sure, and it does, a great question, it does depend on the plan, but those plans traditionally have deductibles. Those plans have copays, they have coinsurance, and what I will go ahead and say is this, and I will just say this from a compliance perspective, Medicare does have rules and regulations that I cannot go into benefits with particular insurance companies, and I will not do that, but just talking about this on a high level
Sure.
of the way that it works. But Medicare Part D, regardless if you have a drug card through a Medicare Advantage plan or if you have a Medicare supplement plan and have a drug card, drug cards work in this parameter. And what I mean by that is they can have a deductible that can be anywhere from $0 to $615 in the year 2026. Once you meet your deductible, if you have one, then you have copays, like would it be $10, $20, to pay, and the prescription drug cards are broken out by tiers. Okay, would it be preferred generic, regular generic, preferred brand name, etc. And so you have different copay levels, but you can also have coinsurance level, which just means you pay a percentage, okay, and instead of a copay. And then you would pay these either copays or coinsurance and include in your deductible until you and for 2026 until you reach a maximum out of pocket of $2,100 for covered medicines. Once you reach that $2,100 threshold, you then move into what they call as catastrophic coverage, and now the prescription drug plan that you're on picks up the covered medications 100% and you don't pay anymore. So this is really big relief and big news for a lot of people, because there used to be what they called these donut holes and these things, and they kind of had an endless out-of-pocket expense limit.
Right.
Well, today you can have a cap on that, which makes that very nice.
That's great. That's why the education component is so important ahead of time. That is great information. That's one of the things that never really mattered to me as a paramedic was Part D. Most time people give you the red, white, and blue card. It's A and B. But people would always want to tell me they had Part D. I had no idea what that was for.
Right.
I do now, but as a paramedic, we don't really care that what you're insured. We're going to transport you no matter what.
Sure.
We just got to give this so that the hospital gets it, and they'll figure that out. But so now we know that this is so important for the drugs, basically. What is E for?
So E, and let me say, no one really needs to know about E. It's just that E is the part of Medicare itself that regulates the different Medicare supplement plans out there. So the one thing nice with Medicare, and I would just say this from a senior component of somebody that's covered underneath Medicare products, you probably have no more stronger protection from the government than underneath Medicare. They make sure that you are really not taking advantage of. And so it's just that when it comes to the Medicare supplements, and we'll also use this terminology, when someone says, Warren, I want to have original Medicare or traditional Medicare, I want to keep that. And that means that Medicare is going to pay your claims. And for this conversation, let's just kind of high level here. We're just going to say that Medicare covers 80%. Okay, let's just high level.
Sure.
Let's just say that as an example. Then what you're going to do, if you want to keep original Medicare where you use your red, white, and blue card when you go to a provider, then you would get a Medicare supplement that would fill those gaps.
Great.
And hence that name also Medigap. Okay, so Medigap, Medicare supplement, that's interchangeable or the same as far as terminology. Now, Medicare Part E, they tell the insurance companies, if you're going to manufacture a Medicare supplement plan, you can manufacture a plan from Plan A to Plan N, okay? So there's all these different variations that kind of go through there. And then so they say the way these plans are. So let's just pick out two plans that are very popular today, and we'll just say a Plan G, okay, as in George, and we'll pick out a Plan N as in Nancy. Okay, those are two popular plans. And those plans, regardless of the insurance company, they have to cover the same exact thing. So what I'm going to say is a Plan G is a Plan G is a Plan G, just like a Plan N is a Plan N is a Plan N. Okay? So, but it's just like let me say the prescription drug cards, if we go back to Part D, we want to definitely understand what medication somebody is on, because there is not one size that fits all for it. There's not one size that fits all for Medicare Advantage. Now, Medicare supplement, we can say a Plan G is a Plan G, but what you will find, and what my experience has shown over the years, I like to stay with more of the household brand name companies, okay? And if you just go and you go call an insurance company and say, I need to sign up for Medicare today, a Medicare supplement or a Medicare Advantage plan or a drug card, whatever insurance company you call, they're just going to tell you, we've got the best plan.
Yes.
And the answer is that may not be the best plan.
Right.
And so we do not steer people to one particular plan. We help do a needs analysis and understand about what your situation is so that we can help guide you towards, like, this is a plan that may really work good for you with this particular insurance company for these reasons. Now, I will say that you will see Medicare supplement plans have gone up in cost here this past year, okay? One of the big drivers of the cost of Medicare supplement plans is that last year they passed a law that said that people that were younger than age 65 that have end-stage renal disease or Lou Gehrig's disease, that they can enroll in a Medicare supplement plan.
Okay.
They were never allowed to do that beforehand, but now they can. And so it has affected the claims pool with the insurance companies, and so we've seen these costs escalate. So what, again, from a professional aspect, we help provide guidance to people which insurance companies we think are good, but there are things that can apply. Household discounts, okay? There can be continuation with certain insurance companies. If you have a current insurance company and we keep you with that insurance company, there can be additional discounts. And so, again, talking to a professional about these particular, what your needs are first, then helping determine which plan is best for you is great because, again, there's not one size that fits all on any of those coverages.
No, and that's great information. And, I think, myself included, I think what's popular out there is knowing that there's a Medicare Part A and a Part B and a Part D. I think those are extremely popular. Everybody knows about it. But I think when you start getting into the plans, the A through N, that's something that most of us are not educated on. And it's so important that you got to discuss what that looks like. And, I really think that I'm going to wind up with more questions than we had answers here. But that's the important part of this is understanding that, we just don't know what we don't know.
Mm-hmm. Sure.
We really don't. Anything, what would you think is, for somebody getting ready to navigate this, they're 62 years old, their adult children are typically a lot of times today, is they're really involved now. We have this whole sandwich generation.
Oh, sure.
And it is the first time we've really seen this where you have people my age or a little bit younger than me who are caring for their toddlers, but they're also helping their parents to make these decisions. Because a lot of these things can get out of control. 62 years old is pretty young. I'm 57 years old, and I feel like I'm 25.
Yeah.
But I still got to start preparing for these things. And
Sure.
if I wasn't in the healthcare industry, I probably would not be so concerned about these things. But I get phone calls, 5 or 6 phone calls a day asking about these things. I'm like, man, let me get you to the right people. So I help people navigate. I'm the GPS system for the Senior Life Network.
Yeah.
I really am. And so getting people to you, getting people to the right attorney, to the right doctors is a lot of what I get asked to do.
Sure.
But if somebody's out there watching this right now and they're like, man, I've got a lot of questions. What's one thing that you would say, hey, take this away from the podcast?
Yeah. So a lot of people call us and just say, what do you recommend for me? Just right off the bat, which plan? I would say, well, that depends. So the biggest difference between a Medicare supplement and like a Medicare Advantage plan is providers. And the one thing is that it's one thing to sit here while we're healthy and say, oh, if I got sick, I would go to these providers. Okay. But when you are sick and you have care ongoing, you're very particular about the providers you want to go to. So I would say one of the things that people need to take away from this is understanding which providers you can use under Medicare, original Medicare, and also underneath like Medicare Advantage. Now, the easy thing to take away from this from this meeting is that Medicare supplement, if somebody can afford to pay the premiums, I'm going to recommend them to go on a Medicare supplement plan. And we'll help them choose the best plan, help them choose the best prescription drug card to go along with that as well. Medicare Advantage, we have high-income people that go on Medicare Advantage plans. But Medicare Advantage plans that probably provide more of the benefits today that are really more robust is probably more on the HMO side. Right. And so somebody has to be willing to go see a primary care doctor first, get a referral to a specialist. There are going to be, in some of those plans, there can be extra benefits. Would it be dental, vision, over the counter. And some of those things, depending on income levels of people, they may find that those particular type plans could be more advantageous for them because they don't have a premium per se. As an example, some of those plans don't have premiums, I should say. And then some of those plans may even have what they call as like a give back, to where they can help them pay some of their Medicare Part B premiums. Wow. So it's not only just what you can afford, it's what your medical situation is, what you're spending on healthcare, what do you need for healthcare. So so I would just say that kind of what's the one big thing to take away is, don't call one insurance company and ask them what's best for you, because they'll put you in that plan, and that probably is not going to be the best plan. That's the one thing I want to tell everybody.
That's great. Just from what you're saying, one of the things that we see often is people receive in the mail, and there are commercials about the Advantage plan. Yes. You don't ever see a commercial about Medicare.
Yeah. Well, so great question and a great point. So during, let me say, between October 15th and December 7th,
sure,
that is the annual election period.
Great.
And that is where you have the ability to make changes, or what we call is like do maintenance. Okay. It's your open enrollment. It's not, let's call it the annual election period. That's the technical term.
But every year you have the opportunity to do this, right?
That is correct. Yes. So that's the annual election period between October 15th and December 7th. You can make changes. So if you're in a Medicare Advantage plan and you're with one company and you want to change to another company, this is the time of year to do it. If you have a Medicare supplement and you have a prescription drug card, and all of a sudden this past year you've been prescribed new medications, now we want to look at a new prescription drug card. Now's the time to do that and have it all effective for January 1. And so of doing that. But you do get an opportunity to make those changes and do maintenance there at that time of year.
But I think it's so important that, again, that you have this education beforehand, because if not, you're basically having to come back every year and learn from your mistakes.
Yes.
You're turning 66 and you're like, man, I made a lot of mistakes this year. Yeah. If somebody could have walked you through this, it could have helped avoid that. And again, every single person is different. They're unique. Their healthcare needs are different. And so understanding what's best for you is truly important, instead of just everybody just going with the same thing. And
that's right.
That's what's really important, and I'm so glad you got to come on. So thank you for joining us on the Senior Life Network podcast. I really want to get you back soon. We enjoyed this.
Well, thank you for having me. Really appreciate it.
You're welcome. Today's episode was sponsored by Help Inc.